Hey, semester two students, here's just a really quick review on mental health and tissue integrity. So with that said, let's get started. This is the outline I made. It's 14 pages from beginning to end over the concepts you will be tested on tomorrow. You can kind of see as I go through how I set it up in terms of causes, clinical manifestations, assessment data, treatment, and so forth. So suicide, who's at risk? Patients with psych disorders or substance abuse disorders, like with alcohol. Men commit suicide more than women, particularly elderly men. There could be a biological factor in terms of suicide and low serotonin levels. Causes, maybe there's a family history or a history of depression, any sort of psych disorder, or alcohol abuse. Clinical manifestations, when a patient presents with suicidal ideations, be sure to ask, is there a plan and what is the plan? And then once they tell you what the plan is, then decide how lethal the plan is. There was a patient one time that came into ER and the physician asked what kind of knot he was going to use when he'd hang himself, which at the time seemed like a really morbid question. But I understand why he asked that now. Also ask for if patients are giving away their things, kind of isolating themselves, like I said, giving away belongings. Assessment data to use for patients with suicidal ideations. Remember SAD persons: sex, age, depression, previous attempt, ethanol use or alcohol use, rational thinking loss. The social supports are lacking. If is there an organized plan? There's no spouse, and there's sickness. Treatment: provide a safe environment. You'll hear ABCs a lot next year, airway, breathing, circulation. But the S on ABCs is safety. So if you have an exam question about, leaving a suicidal patient alone, obviously don't do that. Don't ever leave a suicidal patient alone. Take the shoelaces out of their shoes, take their belt away from them. There's a reason why when mental health patients present to the emergency room in triage, there's a reason why they're given scrubs. It's because they could be hiding something that they could harm themselves with. Make them sign a contract to either postpone suicide or, not to do it at all, ideally. Redirect them, ask for close-ended statements, rechannel their anger through exercise, stay calm, provide restraints only when necessary. Restraints are a last-ditch, effort. Restraints are always the last choice. If you do have to apply restraints, check the patient every 15 minutes, offer hydration. They're not used very much anymore on psych units, but you may see them in the clinical setting. Nursing interventions: primary, obviously, is always going to be safety, any activities that provide support. Secondary would be treatment to the actual suicidal crisis, and tertiary, interventions with the family and friends. Moving on to personality disorders, we'll start with schizoid personality disorder. Clinical manifestations: flat affect, disorganized thoughts, flight of ideas, echolalia. Be sure to know the words and the vernacular used, maybe in the PowerPoint in the book, and know the definitions and know how to apply them. Delusions, hallucinations, maybe childlike mannerisms. They could be devolving or digressing. Treatment: decrease the stimuli, observe, orient frequently, keep conversations reality-based.